Mueller, and we're going to do some more videos about Unna boots. We already talked about the Coflex Unna boot, and today we're going to talk about the profore Unna boot. So the Coflex Unna boot that we went over already has a calamine foam roll and a co-bound outer roll. We showed you how to roll those things, and that's fine. This is the most common Unna boot. But sometimes people have wounds that are wet and oozing a lot of water, so we put something a little bit thicker, a little bit more absorbent, and that's the profore Unna boot, and you'll see them both available to you. So let's open up the profore Unna boot and see what's in here. Okay, first we have a kind of a telfa-like material to put over the wound so that it doesn't stick. Okay, I'm going to put that down there. Next we have 4 rolls, and you can see them all here. They all have numbers, so we usually go in order. Okay, so this one says number 1 on it, and so that's the first roll you put on. This is just a cotton roll, and it absorbs just like cotton would absorb, so it's good. Okay. After that, we put on roll number 2, and you can see it says profore number 2. This is just a little bias roll, and it just keeps the cotton in place and also has a little bit of absorbent properties. And then we go to the next roll, profore 3, which is an ace wrap essentially, and it's kind of thicker and a little bit tighter. And then the final is a co-band roll. It says profore number 4. So when we put all 4 of these things on there, it turns out to be, pretty thick and pretty absorbent. Sometimes you can even put some additional 4x4s or an ABD even somewhere under the wrap if you really need to absorb a lot of water. Okay, so let's put this on, Elizabeth, and we will see how it goes. Okay, I'm going to get all ready. Like we talked about in the other video, preparation is important. You don't want to spend more time on your knees than necessary. So let's get all these things open. Be sure you have enough gloves. Be sure you have a good chuck. Okay. We'll try not to make too big a mess. Okay, so I got these rolls out. Now I'm going to get busy here. Put on my gloves. Sometimes I lay a couple extra. Now you can put some goop on the leg like we talked about before. A&D ointment, whatever you want. That's all good. But now we're just going to roll this thing. Okay. Okay, I take this out. And here it is. It's a cotton roll. Okay, so I'm just going to roll it. And once again, Elizabeth has been so nice to volunteer. Cotton is soft. It tears, easy. It doesn't matter if it tears or not. You just roll it on here. And once again, when you roll your Unna boot, you want to try to get it kind of close to this area of the leg. Otherwise, you get some swelling between the Unna boot and the knee that people don't like. And one other thing is, in the end, do what the patient wants. Sometimes these patients have had a bunch of Unna boots. They know what they want. They know what works. And don't argue with them. Just give them what they want. If they say too tight, make it looser. If they say more stuff here, more stuff there, just do it. Okay, now we're putting on the second one. I forgot to put this on her leg, but obviously just lay it on there. Okay. The profore wrap is 4 wraps as opposed to the other one that's only 2. So, it takes longer. It's a little bit more labor intensive, but not too much. It's all right. Okay, so we got that. That looks good. Okay, it's falling off a little bit. Now we'll put this one on. I don't use a profore too often, only for wet wounds, but they're good. They're good. I know Dr. Prema is a big fan of the profore. He uses it a lot, and it is a popular one overall. Okay, so I'm going to come up here. All right. Do you think you can put your hand there and hold that for me? Mm-hmm. Thank you. Oh, look, we're almost done. Okay. And then stay off the toes. Okay. So this isn't brain surgery, you know, it's just an unna boot. It does take some effort, but it's not bad. I mean, it's not anything that anyone can't do. This particular Koban roll is much easier to roll than the other one in the Koflex roll. I don't usually need to use my unna boot stick for these. Okay, all right. So that's it, right? And we just put it. Just summarize. There's 4 rolls. They say which ones they are. You put them on in order. Roll them up to here. Useful mainly for wet wounds. And that's it. There's no stocking that comes in with this one, so you won't have a stocking. And that's it, okay? Hopefully that's straightforward, and thank you for watching.